With me now is board-certified obesity specialist, Dr. Timothy Quinn. Doctor, thanks for joining us.
Hey, thank you for having me.
This warning comes from 3 cases that were flagged. Is that really enough to warrant concern?
Well, I feel comfortable to speak for the entire medical community to say that if a significant scenario of someone saying or reporting that they had suicidal ideation, that's enough to warrant concern. And there is concern. And this is being addressed in the research as far as the development of the medication. Also, if we prescribe the medication, it's our job as medical professionals to assess for these types of possible complications. But I do want to note from my personal experience, I've had a lot of patients, I'm board certified in weight loss medicine as well as family medicine, that I've started on Ozempic to help with their diabetes and at the same time to help them with their desire to get to a healthier weight. And sometimes I've experienced patients that have articulated that they've been disappointed because they didn't lose weight as fast as they thought because of all the hype associated with this medication, which could exacerbate someone that might have underlying depression or anxiety, which could cause them to have an increased probability of having these suicidal ideations.
While I have you, I also want to talk about the White House's new focus on fentanyl, specifically fentanyl laced with xylazine. It's a chemical most often used as a tranquilizer for animals. The Biden administration says the mixture was found in 11% of fentanyl overdoses last year and has become an emerging threat in the opioid epidemic. We're talking about animal tranquilizers. I mean, what? What is the danger? I guess talk to me about the danger to the human body.
There's a great deal of danger associated with this possible person ingesting this medication, because the deal is the fentanyl is an opioid. And if someone uses the fentanyl, there's a chance that they can get what's called an overdose. And we would treat it with the naloxone or the Narcan. But the problem is when there's that combination, it's even more dangerous. The naloxone, which would be the treatment for the overdose of the fentanyl, it's not effective with the xylazine, which makes it more dangerous. Also, the person can have problems breathing. They can develop skin lesions, have withdrawal symptoms. It goes on and on. But the deal is we just have to really be aware and on the lookout. And what's going on with the Biden administration, they have a very robust education campaign to educate doctors and healthcare workers to be on the lookout for this combination with increased testing for that xylazine, so that if someone comes in, then we have a better idea of how to more effectively treat them.
What a frightening combination. Dr. Timothy Quinn, thanks so much for joining us.
Hey, thank you for having me.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.